Hi.
Hi.
Hello.
Yes, hi.
Hey, I'll tell you what's on my mind.
We asked you to call us to let us know what's on your mind.
I lost my dad from COVID-19 on April 4th. I almost lost my mom to COVID-19.
I lost my brother. He was my friend. He just died this morning, and I am hurting.
Talking about real life in a real crisis.
Get us back to work. The coronavirus has been bad enough, and financial distress is even worse.
I'm a self-employed hairdresser, and we are trying to survive this with absolutely no money of any kind.
I'm ready to get back to work, so this is getting tired, let her rip.
It's been a while since anything has really felt normal.
This pandemic that we're in is something that I've never seen before. Things are changing very rapidly. Critical situations end up more critical, and I'm nervous that things are going to get worse before they get better.
It's very strange how one individual can get infected and have either mild or no symptoms, and another individual could rapidly deteriorate with viral pneumonia and respiratory failure.
I'm scared and I'm afraid. That's it.
I'm very concerned about our loved ones that are in the hospital that has no one there with them. They are very sick and they have to die alone.
I remember my husband standing in the doorway saying goodbye to the kids and saying, Dad has to go to work, and he was crying.
Just 2 days after being diagnosed with COVID-19, 32-year-old Jonathan Coelho of Bethel knew he could no longer fight the virus on his own.
It was really fast how bad it got, and he was really scared. I wasn't able to just hold his hand until he had already gone.
I take care of definitely more Latinos and African Americans that are stricken with COVID-19. There's a disproportionate amount of people that are affected in these minority groups versus our white and non-white counterparts.
Jorge was 34 years old, and he started feeling sick with flu-like symptoms that got worse over time. He tried to go to the hospital in Brooklyn 3 times, but was told he had pneumonia and was sent home.
It obviously wasn't just pneumonia because we came out positive. Me and my baby are positive for the coronavirus, so he obviously had it. They wouldn't test him. Know in my heart that I will never meet someone like him again.
Beatriz is now struggling to understand why her fiance wasn't treated with the level of care that she thought he should have.
I'm sad for me because my life is completely altered, but I'm so sad for my son that he has to grow up in a world without, his dad who loved him so much.
Those that have been touched by this, we can make better decisions, okay? And we can decide to stay home, and we can decide to protect ourselves and protect our neighbors. By taking care of ourselves, we take care of the others.
The mitigation, the physical separation that we've initiated, is starting to have a real effect now.
We are flattening the curve because we are rigorous about social distancing.
Despite pleas from governors, President Trump and his medical experts tonight insisting there is enough testing capacity for coronavirus for large chunks of the economy to reopen.
We've already built sufficient testing capacity nationwide for states to begin their reopenings.
I'm calling on the states again to note that an informed community and knowledgeable community is a protected community. So make sure all of your states have your cases visible to the communities so they can make decisions.
Small business guys, we're suffering real hard here, and they need to go ahead and open this back up. It's time.
We really need to be careful and prudent and considerate of everybody's health, our health and the people around us. I have no money, no income, no nothing. I try to get involved with the unemployment. Nothing happens. I can't get anywhere.
Shouldn't we just cautiously open up some businesses, especially in areas that virtually have no cases?
I'm living on a very, very low fixed income, and I'm worried that I won't have enough food to eat.
As parts of the country prepare to reopen and President Trump touts a light at the end of the tunnel,
it's going to be gone at some point. It's going to be gone.
Top health officials warn the fight against the coronavirus is far from finished.
We need to push the government to open more businesses so more people can go back to work
and they do not have to wait in lines at food bank.
Look at what's happening all over the United States. I mean, there are people that are not, able to get food. They're in long lines in cars.
If you do the math, the logistics manager here says these volunteers are helping serve about 12 people a minute. And almost 4 weeks into this operation at the Rent, the need is still huge.
We are fighting two pandemics. One immediately is COVID, the other historically is poverty.
What's on my mind is get the state open, get the state open, get the state open. This is ridiculous.
I feel that we're not being told the truth here. Every day we see there's more deaths, and yet we are talking about opening things up.
Today we're releasing additional guidance on testing to inform the states as they develop their plans for a phased and very safe reopening.
My dream was always to have my own place, and to just watch that crumble right before your eyes when it's something that you have no control over, it's devastating.
I want to know what's happening with this testing. They say everybody should get tested. My wife and I are both over 70, and neither one of us supposedly qualifies for testing, even with this new push to get everybody tested. What's going on with that?
The testing requirements are very unclear to me. Is the goal that everybody should get tested, whether you have symptoms or not? Or it's only if you have symptoms? Do you need a doctor's note?
I think the state is opening way too soon. If anyone wants a test, whether they're asymptomatic or not, they simply just can't go get a test. There are certain criteria, and that needs to change. We need to be able to test anyone to know how far this virus has reached.
Things are changing ever so rapidly with the presentation and the ability to quell the virus once it's really taken a toll on the body. We do know what's working, and we're still finding out why it's working, and we're still kind of working through those pathophysiology and pharmacological agents that really increase respiratory health in those that are very, very sick. Things are changing with the virus, things are changing with the treatment, things are changing even with hospital stays, length of hospital stays, the ability for people to get off of ventilator once they're on a ventilator. So I just cannot drive home the point enough to wear a mask in public and protect yourself and those in your community.
I am not comfortable being a senior and going out until we have full testing in the state.
I don't know what to do. How can they open all of these places when everybody hasn't been tested?
Our area has not been devastated by the COVID virus. Our cases are low. Our businesses are ready to open following the guidelines and protocols for public health and safety.
We need to open the state. We need to get our people back to work. We need to open the daycare. This is nuts.
I think the whole world needs a whole lot of love and help, and I hope that this terrible plague changes us all for the better.